Of that old adage that there's no better teacher than experience. So I've experienced that, thank you. And I'm actually super happy to be here. So there are two more people in the room that I would like to acknowledge just briefly. The first is Michelle Prosner. If you could just please stand. Hello. So, Michelle works for the Association of Community Health Centers, and she's going to be speaking briefly, just a couple words, on behalf of the new primer that you guys just released. And so, the primer is a document that's on the tables out there that is on community health centers that were created for the campaign. So, Michelle, if I can just have you say a few words about your relationship to the campaign and the primer, that'd be great.
Good afternoon. Probably not the best position to be speaking right after lunch, so I hope you keep eating dessert so you're nice and sugared. But thank you so much for having me here. As you mentioned, I'm with the National Association of Community Health Centers, and our colleagues at the Geiger-Gibson Program and the RCHN Foundation have put together a really great primer on community health centers. It sounded like there was a lot of discussion about how community health centers, or also known as federally qualified health centers, are really important partners in this work, and they're a resource out there to be leveraged. Health centers right now serve over 24 million people nationally. 1 in 10 kids go to a community health center, and we're going to see those numbers continue to rise, I think. They're also reaching, their total patient population right now is about 49% Medicaid coverage. They are the ones that really bear a lot of witness to what social determinants, how they impact health and how they impact wellness overall. So the health center model was designed to integrate not just the clinical, including the preventive medical, dental, oral health, and other services, but it was designed to integrate those services into social services as well. So many health centers out there, actually all of them, are doing more than just clinical care. They're working with community-based partners. Many of them are working with schools. According to a recent survey that our colleagues at the George Washington University did with NAC, about 2/3 are working directly with or offering Head Start or child care programs. So just one example. We know some health centers, including Mary Center, as you heard from this morning, they're operating charter schools, and a lot of them are also offering after-school programs. So there's a lot of partnership that's already happening. Meanwhile, health centers are also working to systematically document the data behind what those patients' social risk factors are. We are leading an effort to help health centers do that nationally. So that data can be used not just to improve care for that patient and that family, but also to lead to systematic change so that the system of care, the whole community, can be better integrated. So let me just close to say that thank you for having me, and that we look forward to continuing the conversation. And we think health centers are really great partners in this effort.
And Cody Cornack, you don't need to speak, but if you can just stand for a minute. Cody is our representative from National Head Start, and she's a policy and research associate, and so we're so glad to have Head Start in the room. Thank you. Okay, so let's start looking at Medicaid as a children's program. And as the campaign for grade level reading was really honing in on their focus on health and Medicaid, everybody kept talking to the campaign about what's happening in Georgetown and the Georgetown Center for Children and Families. And so we are especially excited to hear about their work with the Sarasota Herald Tribune. And I want to introduce our keynote speaker for lunchtime, Joan Alker. So Joan is the executive director of the Center for Children and Families and a research professor at Georgetown University, their School of Public Policy. So the Center for Children and Families is an independent, nonpartisan policy and research center that was founded in 2006 with a mission to really expand and to improve high-quality, affordable health coverage for America's children and families. Joan's work has focused on health coverage for low-income children and families with an emphasis on Medicaid. the Children's Health Insurance Program, and the Affordable Care Act. It's our great pleasure to introduce Joan and to hear her words of wisdom. And this is going to be followed by some remarks from Elizabeth Burke-Bryant. And Elizabeth is actually a dear friend of one of Dr. Lubin's and my colleagues, Dr. Jyoti Marbin. And Elizabeth is from Rhode Island Kids Count, and her passions, as I learned on her Twitter feed, are that she loves victories for kids and the beach. Come on up.
Great, thank you. So I'm really excited to be in this room. There's a lot more positive energy in this room than most of the other rooms I've been in Washington in the last week. So this is great. And the reason that we're going to show a video in a sec, which is a really exciting, and I will say for those of us at Georgetown since the election, we've been engaged in a lot of internal meetings talking about our work plan and how has it changed and how does it need to change. And we started this body of work about a year ago, and the body of work was thinking about Medicaid as a children's program. And I felt that it was really important for us to do a lot of public education about Medicaid as a children's program. For a couple of reasons. There are very big Medicaid debates even prior to the election that have been going on about Medicaid expansion in many states. That is a children's issue because parents' coverage is at stake there, but nobody was thinking about it that way. And of course, we perennially have budget discussions. You all have budget discussions at the state level every year that involve Medicaid. And we have them here, although up until now they have been relatively muted, but there has been significant interest in cutting Medicaid at the federal level that we will now be talking about in a minute. So my thought was, even in all of these big discussions about Medicaid, nobody's thinking about children, right? Children are half of the beneficiaries of Medicaid. Most people don't realize that. And when you hear the word Medicaid, you think, it's some big bad thing, rather than conceptualizing and visualizing that it's children. So this is some work that we undertook. And sort of during the course of that work, we were approached by the Campaign for Grade Level Reading to think about some ways we could partner together and work together. And we were very excited about that because one of the things that I think is more timely now than ever is that we need to stand together and understand that healthcare and education are intertwined, that's good. Inextricably linked, I think that's what I was going for. They must stand together, and you can't succeed in one without the other. And that I say particularly to you now in these tough times, that is more important than ever. Because if we are divided in the way we think about children and their interest, we will lose. So that is why building of these bridges is so critical, and I'm so thrilled you're having this meeting, and we are going to start by showing our video. No, it's a different. Where's our friend Jerome? He's totally on top of it.
Every child should have the opportunity to have health insurance coverage and care. We know that children with health care, they're well positioned to succeed in life.
As a teacher friend of mine said to me recently, you can't teach to an empty desk. So the first thing that teachers know is that children's absences not only hurt them, but they hurt the whole classroom because the teacher has to go back and teach over and over again to pick up from the 4 or 5 kids in the room who miss because they are ill and they don't have health care coverage.
As a pediatrician, my greatest job is to help children grow up healthy. Medicaid and the Children's Health Insurance Program help children to grow up to reach their full potential. I've seen in my own practice that children who have insurance are much more likely to come in for the well-child visits, and I have access to reaching the family and helping them understand prevention.
The good news is that our country has reduced the uninsured rate to a historic low, and that's really thanks to Medicaid and CHIP. And Medicaid has been the primary reason that that uninsured rate has come down to this historic low. Medicaid is a very smart investment. We know from a growing body of research that when you invest in kids, you're going to improve their health, both when they're children and when they grow up.
More than 1/3 of all children and nearly 2/3 of children with disabilities rely on Medicaid and CHIP for their health care. Without Medicaid and CHIP, families would struggle to afford the care their children need.
Schools are seeing a whole lot more children now with chronic illnesses, and the challenge with them is to make sure that they get early treatment and monitoring so that somebody is really watching out for them all the time. And with Medicaid and EPSDT, that can happen.
Medicaid's EPSDT, or Early and Periodic Screening, Diagnosis and Treatment, means children can get hearing and vision tests, developmental screenings, and other pediatrician-recommended care.
There's no question that the overall well-being and prosperity of our country is linked to that of our children. And our investments in our children are going to not only benefit them, but have benefits for the entire society. So doing away with or weakening programs like Medicaid and CHIP are not only going to have detrimental effects on children's health, they're going to have detrimental effects on our ability as a country to succeed and prosper.
Great. So I want to thank Jean for doing a fabulous job. And I must tell you, we didn't give her a lot of time to prepare. We were on a tight timeline. And also to acknowledge Kathy Hope, our communications director, who was in charge of this project. And I think she did an amazing job as usual. This literally was the debut. We just finished this like over the weekend. Please talk to Kathy if it's something you all think could be useful in your work. We are more than happy to share. We have a longer version too, I believe, which you may or may not want. But I think this is a great opportunity to educate folks about the nexus of health and education. So we're really excited to work with you all on that. So with that, I'm going to go through my slides. I know that you heard a few of these things already this morning from my colleague, Vicki Wachino. But I'm going to be a little bit repetitive, and so let's just go to the next slide. Okay, so this is, everybody knows this now, right? I have a question for you. How many people knew this before you came to this meeting today? Raise your hands. Okay, so maybe about half the room. So we do an annual report at Georgetown CCF, and we go through all 50 states, and we look at your uninsured kid rate as it going up or down. And so this year, we actually moved this report out very quickly, the quickest we've ever done it. We moved it out in the end of October because I knew we were going in a good direction, but I actually didn't realize that due to the Affordable Care Act, we were going to have an even quicker decline than we expected. And the data was so clear this year that I said, we got to get this message out. All right, let's go to the next slide. So this too you've seen. Now this has been a long trajectory for children. This way predates the Affordable Care Act. It really starts in the 1980s when the Medicaid program was expanded for poor children, led by Henry Waxman in California. That was phased in over time in 1997. The Children's Health Insurance Program was layered on top of that. But really, Medicaid has been the backbone, and CHIP and Medicaid have worked together. And then the ACA kind of came in and really accelerated that progress. But it was building on a world of success that we had for literally working decades for Medicaid and CHIP. So another critical issue, and I think Vicki touched on this, but parent coverage, which was way behind children's coverage because we had been working on that for so long as a country. Parents were lagging way behind, and other adults, of course. So we have seen a dramatic improvement in parent coverage in the last couple of years thanks to the Affordable Care Act. And the other thing important to remember, particularly for parents, a lot of this is due to the Medicaid expansion in the Affordable Care Act. Most of the discourse you hear about the Affordable Care Act, and even most of the discourse you hear right now about repealing the Affordable Care Act, is about the marketplace, right? We do not hear a lot, unless you're in a state that has an active Medicaid expansion fight. That's not the part of the Affordable Care Act that you hear about. So I think this is an immediate challenge for us that work with low-income children and families to educate the public about the Medicaid expansion and the fact that that is due to be repealed in January. Let's go. Okay. So this is just to give you a sense, and I love this slide because I think this slide is a very hopeful slide. This is all states in uninsured rates. This is in our report, so you can go grab the report, look at your state. But the point of this is to show the states that are in blue are doing worse than the national average. The states that are in gold are doing better than the national average. And the states in white are about at the national average. So first thing to take away is in the last couple of years, we've seen widespread progress across the country. Of course, because Medicaid and CHIP is a complex federal and state interaction, there's the federal policy and the state policy, and they both affect the outcomes. But we've been doing this report. This is the 6th time that I've written this report. We look at a 2-year period, and we saw 41 states see statistically significant improvements during that 2-year period. Typically, we have 20. But thanks to the Affordable Care Act, and I'm going to explain the reasons why, we saw 41 this time. But here's what I think is hopeful about this map. When you see maps like Medicaid expansion maps, or you see maps of a lot of things, infant mortality, you tend to kind of be able to predict which states are going to do better and which aren't. And I think there's some real surprises on this map. And it speaks to, in our world where we have to be bipartisan, we have to think about bringing and bridging divides, that children and their health insurance is a way to do that. I mean, I spent a lot of time in Florida. I don't know if there's anybody here from Florida. Yes, hello, Florida friends. Yes, there's my friend Deb. So she knows what I'm going to say. So Florida, unfortunately, has been, Florida and Texas, Texas is now ranked 50th in the country for their uninsured rate. And Florida has been bound 49th for most of the last few years that we've written this report. Florida actually made a fair amount of progress because of the Affordable Care Act, and I think rocketed up to maybe 45 or 44, I don't remember. But the point is that you could say, well, the South, that's an area where we tend to see not so much progress. But on children's health insurance, we actually have a few states in the South that have done a wonderful job. And let me just highlight Alabama for you. Alabama's at 97% coverage. And Alabama has been a leader. And Louisiana has also been a leader, was really out front on some great policies. So I know when I show, I tend to, when I'm in Florida, I just pull out the South. And I say, hey, did you know that Alabama was doing a lot better than you were? And they're pretty surprised. So I think it speaks to, like I say, the fact that you see gold there in all different places is a really important lesson and something for us to build on. Okay, so we can go to the next slide. So we've touched on this, but just to underscore, we have a 3-legged stool. As I just talked about, Medicaid, CHIP, and the ACA. And if you go to the next slide, Medicaid is the big ball game here. 37 million children covered at one point during the year in the Medicaid program. Then you have the CHIP program, which of course is very important, about 8 million children in the CHIP program. But the CHIP program can be implemented by states in one of 2 ways. It can be a Medicaid expansion, so those kids are actually in Medicaid as well, but they have a CHIP financing dollar attached to them. Or states can do a separate CHIP program, which is more like a block grant program. So in fact, Medicaid, if you add the 4 million CHIP kids that are actually in Medicaid, we're up to over 40 million kids in Medicaid. And the marketplace is a tiny, about 1 million kids. So you can see for kids, Medicaid is the ball game here. But having said that, I do want to talk about a couple of provisions of the Affordable Care Act. Why has the Affordable Care Act made such a big difference? Because the Affordable Care Act wasn't about expanding Medicaid for children. What has made the difference in really accelerating the progress? Well, it's really been, I think, two things. The first, and I think Vicki probably alluded to this, but this is something we call the welcome mat effect. And Kathy gets credit for coining this term, and we're trying to spread this all around the world, so please use it. But researchers used to call it the woodwork effect. And what that means is that when you expand coverage, like if you expand coverage to parents, or like when Massachusetts expanded coverage under Governor Romney to mostly everybody, many kids, because the majority of uninsured kids today are already eligible for Medicaid. They're just not enrolled. 2/3 of uninsured kids, it is not undocumented immigrant kids. That is a real issue, but it's a very tiny percent of the uninsured kids in this country. 2/3 are eligible for Medicaid, but they're not enrolled. So when you do any kind of coverage expansion and the amount of tension we've had about there's a mandate, there's a need for health coverage, there's all these millions and millions of dollars going into ACA outreach, and you get those parents coming in, other folks coming in, and the parents were coming in maybe to the marketplace. They learned that their child was eligible for Medicaid or CHIP, or their child has fallen off Medicaid or CHIP, and they got re-enrolled. So that's what we call the welcome mat effect. Like I say, a lot of folks call that the woodwork effect, but we thought that sounded too much like bugs. So Kathy beautifully invented this new term, the welcome mat effect. So the welcome mat effect of the ACA has been a real driver for that sharp reduction we saw in kids' uninsured rates. So that, of course, is something that is at stake. The second piece of the Affordable Care Act that's critical for kids, again, no discussion in the large public discourse, is the Affordable Care Act included a provision called the maintenance of effort, which requires states to keep their Medicaid and CHIP eligibility level where it is. They can't roll it back right now. So states probably would have been tempted to do that because they could roll back and those kids could go in the marketplace. And that wouldn't cost the state a dime because that would be federally funded. Now, that might be a tempting proposition for states, would it not? The reason why that provision was included in the ACA was because this was before the marketplace were up and running. Maybe it would be a little tough to get them up and running, people thought ahead of time, so that was pretty prescient. And secondly, CHIP coverage is very strong. Medicaid coverage is very strong. Marketplace coverage is not as good for families and kids as Medicaid and CHIP coverage. The costs are higher, the premium costs are higher, the deductibles are higher, the benefits package is not as robust. So that's why we've had the maintenance of effort, and that will be repealed if the ACA is repealed in the coming beginning of 2017. Okay, so let's move through. This is just more for y'all to have. This is looking at the share of how kids get their coverage. Employer-sponsored coverage, still the biggest source of coverage for kids. Basically, in the 2-year period we looked at of the ACA, stayed the same, which is a very interesting, because you heard a lot about the ACA was going to destroy employer-sponsored coverage. For kids, stayed exactly the same. Medicaid primarily going up, and that's why we see the reduction. There's some kids in the marketplace, as we discussed, but mostly those kids getting Medicaid is what drove the decline in the uninsured rate. We can go to the next slide. So this, I'm guessing, Vicki probably talked about as well, but I think for your mission, and you all understand this better than anybody, that learning begins at birth, and the need for healthy development and ensuring that happens is absolutely critical to impact a child's ability to learn. I am quite confident that most people don't know that 44% of children under age 6 are covered in Medicaid or CHIP. Huge. It's almost half of the kids under age 6 in this country. So we can go to the next slide. The public is not aware of this success. Now, we did some polling as part of that work I mentioned to you that we were engaged in for about a year now, and related to releasing our annual report, and asked folks, do you think the number of uninsured children is going up, down, or stay the same? And this was, when was this in the field, Kathy? It was October, maybe? Yeah. So 49% of the public thought the number of uninsured children is going up, even though it's been going down for many, many years. Only 28% got the answer right. So this is why we have a lot of work to do. We have a lot of public education to do about children, their health care, and the role of the Medicaid program, and we got to do it darn quickly. So let's go to the next slide. Let's talk a little bit about that public education and how should we approach that. So we did a report last year at Georgetown that looked at, it was Medicaid's 50th birthday. So there's lots of new research coming out in peer-reviewed journals that very few people read that talks about how Medicaid, because Medicaid expansions, as I talked about, were phased in the 80s and 90s, and so those kids, there was somewhat of a natural experiment there with some states doing it and some not more quickly, and ages being phased in. So a lot of researchers started to look at, well, what did that mean for those kids? And so there's lots of interesting findings coming out, and we summarize them in our Medicaid at 50 report. I just mentioned a few of them here. Health benefits in the short term and the long term, educational benefits, more likely to stay in school, even more likely to graduate from college, and better economic success as adults. So all kinds of good stuff coming out, and I think we did some work, some focus groups in the South with Republican mothers last spring, because we really wanted to talk to Republican women and see how they reacted to messages about Medicaid and kids, like I say, as part of this effort to think about Medicaid as a children's program. And first of all, they were completely shocked. They had no idea that so many kids in their state were on Medicaid. We were in Alabama, where almost 50% of kids are on Medicaid or CHIP. And they were so shocked, by the end of the group, they said, wow, I really need to pay more attention to Medicaid. I will tell you, they had, well, all right, I'm gonna stop talking about that because I only have 3 minutes and I gotta get to the punchline here. So, okay. So they could kind of quickly go to a bad fraud and abuse place, which I can explain, but they did resonate with the messages that related to research showing X, Y, or Z, okay? They don't like a lot of numbers, but the basic concept of, research found that kids do better as adults really spoke to them because they don't feel good about the direction of the country. So something that makes an intervention for them that says Medicaid is an intervention that could help us in the long term get to a better place, I think that really spoke to them, but we have more work to do. So here's the thing. I hate to be the skunk at the garden party, but all 3 legs of our stool are potentially on the chopping block next year, starting in January. So we don't have a lot of time to work on this. And first of all, obviously the ACA repeal is up right away, and that includes the Medicaid expansion, that includes the maintenance of effort that I mentioned, and some other provisions I won't get into. The second issue is the CHIP program's funding is expiring next year, so Congress will have to act on that. And the third issue is that Medicaid itself, which as we've all determined is the big blob here, is very much at risk. I have been working on Medicaid for 25 years now in Washington. I've been through a number of Medicaid fights. The way the fight will go, the direction of the discussion, I should say, will be about cutting federal funds and enhancing state flexibility. So I want to just unpack that a little bit for you, just to give you a sense of the dimension of the kinds of cuts that we may be seeing. Speaker Ryan's budget resolution a couple years ago, over time cut 1/3 of the Medicaid program, 1/3. We're talking hundreds of millions of dollars of cuts. They will say state flexibility is great, and you all know many reasons why state flexibility is great and can be great. But this is not, when you have 1/3 of your budget cut, states don't have good choices. When the table is not well set and people are fighting for the scraps and you have vulnerable populations potentially in a Medicaid block grant fighting each other. I'm talking seniors in nursing homes, people with disabilities, children's. You are fighting over the scraps. It is not going to be pretty. And that is our challenge because we have to define what that means for people, for children and families. So state flexibility is a good thing, but it's not a good thing when it's about eroding federal guarantees like EPSDT. There are many ways that EPSDT could be under threat. There could be a direct effort to simply repeal it as part of a block grant. There could be administrative and executive authority efforts to waive it through federal Medicaid waiver process. And then finally, there could just be no enforcement of, for example, managed care rules where most kids are getting their care. And that's where EPSDT has to happen on the ground, is in those managed care contracts. So when you hear state flexibility, we can all think of a lot of good things, and that's great. But bear in mind, when the funding is cut and the strings are detached, one of those strings is EPSDT. So I just want you to keep that in mind. So with that, I think I'm getting the hook, so thank you very much.
Hi, I'm just sort of like a pop-up box.
You're a pop-up box.
For
You
about-
have 1 to 2 minutes.
That was all I was planning on, so that makes it even better. So I'm Elizabeth Burke-Bryant. I have the privilege of working with the campaign on policy issues because I've been working on them for 25 years in Rhode Island, know a lot of you in all of those relationships. But my job is really, as a state partner to the Georgetown Center for Children and Families, just give you a quick couple of innovations with Medicaid, as brain food as we go into the next couple of fabulous panels. So in Rhode Island, one example, and I want to know, and I want to just be clear, I am speaking from a platform that's a strong right care program. It was named by CMS as the top Medicaid managed care program in the country last fall. So I want you to know that we have a real strength and we've really been at it a long time. But these innovations, I think, can give you some ideas. Way back when we started Kids Count, we were in 25 years ago, we were reporting a very, very high rate of lead-poisoned children. We have old housing stock in our New England state, and it was just really an epidemic. For kids in the core cities, it was over 30% of all kids, and it was a statewide problem. So our DHS director, when she came in, at the time, Christy Ferguson, about 10 years after we started, she had been very active in late Senator John Chafee's staff, and she really had a Medicaid brain. But so she comes in as DHS director, and she sees the cost of failure, all of these kids getting lead poisoned, and then using precious dollars to give them very, very complex care in hospitals and other places. And she said, wait a minute, that's crazy. Why don't we have Medicaid for windows? And we said, Christy, what do you mean? And she said, Medicaid for windows. We need a Medicaid code that our providers can use to say, we know that there's the dangerous lead-poisoned peeling windows, and rather than paying for the cost of failure when the kid gets lead poisoned, let's have a Medicaid code for window replacement. And we got that through our Medicaid waiver, our 1115 waiver. So that's an example, and we still have it, and it's still used, and it's still a really important prevention tool using Medicaid as a lever. The second one is that we've heard a lot, and I'm going to be involved with the workshop on dental and oral health care. What we hear around the country is that private dentists don't want to see Medicaid-covered kids because they have so much of a headache with dealing with all the administrative paperwork. In Rhode Island, 10 years ago this month, we launched Right Smiles, which is a Medicaid managed care for dental. So our Right Care kids are in Right Smiles, and it saved all the front office headaches for the dentists and farmed them out, economies of scale, to our managed care provider. Before the launch of Right Smiles in Rhode Island, we had 27 private dentists seeing Medicaid-covered kids. At the launch of Right Smiles in 2005, 90 dentists were seeing Medicaid-covered kids, and today, 359 dentists in Rhode Island are seeing Medicaid-numbered kids. Now, of course, we're a small state, but if you do the math, you can see the impact that kind of innovation made in actually having kids get care. So that was my pop-up box. Back to you, Joan.
I'm just going to say one final thing, which is this is our website. Obviously, I threw a lot at you. I'm happy to take questions. We have a very active blog. We have a couple of blogs up already, and we'll certainly be doing more. We also have, and we'll be doing more fact sheets, basic fact sheets on Medicaid as for children, its role for children, and so we are working as fast and as hard as we can to develop more of those materials. So I really encourage you to stay tuned. I cannot stress to you enough, this is a historic moment. We must act very quickly, we must educate ourselves, and we must take action, because the structure of everything that we all hope to build on, it is at risk. It is at risk. So the time is now to really open your eyes and really engage in this debate. So thank you.
Thank you so much for those really timely remarks. And the call to action is now, figuratively and literally. So we are actually going to roll up our sleeves and get to work and start breaking up into our small groups. And I refer to these leaders of the programs you're about to hear more about as being leaders of solution shops. And by that I mean these are real innovators who have actually flipped the switch. And so they've turned problems into opportunities. And how can we actually all work together to harness the opportunities of the moment, even given the context of the hard times that we just heard about? So there are 1, 2, 3, 4, 5 different groups. I'm going to tell you the titles and the rooms to go to. So the first group is Healthy Births and Infancy, a 2-generation strategy, and that's going to be moderated by Ann Mosley from the Aspen Institute and Ascend at Aspen, and that is in the Bloomberg room. The next group, which is across the atrium there. And you know what comes to mind? I'm thinking atrium ventricles. I'm sorry, that's immediately where my mind went to. Okay, so now we're going to do Healthy Early Development. And Healthy Early Development is being moderated by Suzanne Meekneck from Mid-Iowa Health Foundation. Middick, awesome. You wear purple too, right on with the purple. And you're in the winner's room. So that's very fortuitous, which is that way. I was going to make a comment about vascularity and how you go from the atrium down the... It'll let it go. Okay, the next group is Oral Health, and that is being moderated by Ann Siegel, who's a senior fellow at Child Trends, and that's in the Lisa Gore room. Which is third of the big room we were in earlier. So it's the big room that's divided into 2. The next is Healthy Vision, which is Susan Pepkin from the Virginia G. Piper Charitable Trust, and that's in the Murrow room, which is also part of the big room. And the last is Healthy Homes, Schools, and Communities, which is moderated by Debbie Chang from Nemours Children's Health System, and that's in the Zanger room. Zanger? Right over there. And so these groups are intentionally, I know you all got that. These groups are intentionally small, and so don't worry if there's only a handful of people. It's actually better that way, because after these hour-and-a-half groups, they're going to be presented to the larger group, all of the great lessons learned and action plans and alignment for us to move forward. Thank you.